Now to a health alert. Florida leads the nation in new HIV cases for the third year in a row. You know, there are 6,000 people diagnosed just last year here in the Sunshine State. And now Florida health policies are being criticized because recently Governor Rick Scott and the state's top health officer decided to cut health care funding. State lawmakers are questioning whether or not that has contributed to the rise in HIV. Here in our area, there are resources available to people diagnosed with HIV or AIDS. And here to tell us more about that is Heather Vaughn with Lutheran Social Services. Good morning to you. Thanks for being here. Do appreciate it. You know, HIV, AIDS, I mean, this is an old virus that we heard a lot about. I mean, remember Magic Johnson? It's a little surprising to hear that Florida leads the nation, considering that you would think that so many people know about the risks, but it doesn't sound like that's necessarily the case, at least here in Florida.
That is true. You know, Florida does lead the nation in cases. In some areas of Florida, numbers are up, while the nationwide trend is going down. No matter what the reason, it's really hard to nail down what one particular thing causes that. Whatever the case may be, the one thing we really got to do is early detection of HIV. Promoting that early diagnosis is the key to eliminating this virus and cutting down the numbers. Locally in Jacksonville, we have about 350 new diagnoses a year. With that, if individuals get early access to care, we have a really good, robust system in Jacksonville. So if you get into care early and you're diagnosed early, it cuts down on healthcare costs. It increases your quality and length of life. It also decreases the ability that you would unknowingly pass this disease along to someone you love or care about. The other things we have to do in Jacksonville to address this is to decrease or eliminate the stereotypes and break down barriers. At Lutheran Social Services, we provide services to a vast array of individuals. They're about as vast as the demographics of Jacksonville.
So men, women, what age group do you see most prevalently in our area?
The one thing about HIV is it doesn't discriminate. Yeah. It doesn't care if you're young, you're old, if you're white, you're black. Doesn't care how much money you make. It just cares that you're human. We provide services to individuals that do about anything you could think of. We have teachers, preachers, lawmakers. We have your corner store bakery. We have everyone. This disease, it doesn't discriminate.
And is it typically then passed through intravenous drug use or sexually transmitted, typically in our area?
It is. Ideally, we want to have access to individuals before they're exposed.
Right.
And the way we do that is through education. You have to know how HIV and AIDS is contracted, and that's contracted through bodily fluids. That's through sexual contact, blood-to-blood contact, or mother-to-child.
And are you finding, because as we were talking about early detection, why it's so important, I mean, you're talking about in terms of just cost to fight this virus, goes from 1 or 2 pills a day to 20 pills, and these can be really expensive.
They are really expensive. The average cost of an HIV drug is around $2,000 a month. And
wow.
Or, you know, if you're on private insurance, those are your higher tier medications, so copays are really high.
And what we have to remember is we all end up paying that.
We do.
I mean, that forces up the cost of health care.
Yes. One of the things that we're really trying to promote in our area with the early detection and identification is routinizing HIV testing, getting the message out that anyone can be tested for HIV. When you go into your primary care physician's office, when you do your well-check visits, you should ask to get an HIV test if you've never had one. If it's done in tandem with your annual visits, it's even covered by most healthcare insurances. The one thing that you have to know is that HIV can affect anyone. And the simple fact is, if you've never been tested, you truly don't know your status. So if you haven't been tested, get out. You can get a test done at your primary care physician office. We have wonderful partners in this community that do free testing. You can get tested for free, and then you know your status.
And covered by insurance as well.
And sometimes it can be covered by insurances, yes.
Thank you very much, Heather, for being here. Do appreciate it. Important information, certainly, to all of our viewers. And for more information about Lutheran Social Services, by the way, you can head to its website, lssjax.org. We'll post a link with this interview, in fact, on the morning show page. Just look for news4jax.com.